me one.
Go.
Okay, this is the horizontal recumbent position. This position is used for examination or treatment of the front or anterior part of the body. The patient lies flat on their back with their legs slightly apart. One small pillow is allowed under the head. The arms are flat at the side of the body. The drape is placed over the patient but left loose on all sides to facilitate examination or treatment.
This is the prone position. This position is used to examine or treat the back or spine. The patient lies on the abdomen and turns their head to either side. A small pillow may be placed under the head. The arms may be flexed at the elbows and positioned on either side of the head or positioned alongside the body.
This is the Sims position. This position is used for simple rectal and sigmoidoscopic examinations, anemias, rectal temperatures, and rectal treatments. The patient lies on their left side. The left arm is extended behind the back. The head is turned to the side, and a small pillow may be used. The right arm is in front of the patient, and the elbow is bent. The leg is bent or flexed slightly. The right leg is bent sharply at the knee and brought up to the abdomen. Draping can be done with one large sheet or two small sheets that meet at the rectal area.
This is the knee chest position. This position is used for rectal examinations. The patient rests the body weight on the knees and the chest. The arms are flexed slightly at the elbows and extended above the head. The knees are slightly separated and the thighs are at right angles to the table. Draping can be done with one large sheet or two small sheets that meet at the rectal area.
This is the Fowler's position. This position is used to facilitate breathing, relieve distress, encourage draining, and examine the head, neck, and chest. The patient lies on their back. The head is elevated to one of three main positions. Low Fowler's, the head is elevated to a 25-degree angle. Semi-Fowler's, the head is elevated to a 45-degree angle. And high Fowler's, the head is elevated to a 90-degree angle. The legs lie flat on the table, but the knees are bent slightly and are sometimes supported on a pillow. One sheet is used to drape the patient. The sheet is left hanging loose.
This is the lithotomy position. This position is used for vaginal exams, pap tests, urinary catheterization, cystoscopic exams, and surgery on the pelvic area. The patient is positioned on the back and the knees are separated and flexed. The feet are placed in stirrups. The arm rests at the sides. The buttocks are at the lower end of the table. The lower end of the table is dropped down or pushed in depending on the model of the exam table. Draping is done with one large sheet placed over the body in a diamond shape.
This is the dorsal recumbent position. This position is similar to the lithotomy position, but the patient is in the bed or on a table without stirrups. The feet are separated but flat on the table/bed. The knees are bent. Draping at other points are the same for the lithotomy position.
This is the Trendelenburg position. The position increases circulation of blood to the head and the brain and can be used for circulatory shock. The entire bed or table is elevated at the feet and the patient lies in the horizontal recumbent position with the head lower than the feet. The surgical Trendelenburg position can be used for surgery or pelvic organs and for pelvic treatments. The patient is flat on the back. The table is lowered at a 45-degree angle to lower the head, and the feet and lower legs are inclined downward.
This is the jackknife position. This position is used mainly for rectal surgery or examinations and for back surgery or treatments. The patient is in the prone position. The table is elevated at the center so that the rectal area is at higher elevation. A special surgical table is required for this position. The head and chest point downward. The feet or legs hang down at the opposite end of the table. The patient must be supported to prevent injury. Straps are used to hold the patient in position. Draping is done with a surgical sheet that has a hole to expose the surgical or treatment area. Two small sheets that meet at the surgical or treatment area can also be used.
The knees are separated and flexed, and the feet are placed in stirrups. Elevated at the feet. Patient lies in a horizontal recumbent position with the lower head.
This is a jackknife position. This position is used mainly for rectal surgery or examinations and for back surgery or treatments. The patient is in the